Hello and welcome to Liverpool City Region Creating Careers. On today's episode, we're joined by Katherine, Lindsay and Hayley, who all work in dentistry at Mersey NHS Foundation Trust. Morning, thanks for joining us today.
Morning.
Brilliant. So students, do not forget there is a piece of pre-work for you to complete with this episode. If you have not done that, go to the description below. There you'll find all the links you need to our website. You can download the pre-work there, and then you can come back to us nice and ready to begin today's episode. Brilliant. So to kick things off, Katherine, would you mind giving us an introduction to your role?
Certainly. My name's Katherine. I'm a senior dentist working for Mersey Care. We treat special needs adults and special needs children across the whole of the Merseyside region. That typically is phobic children or children with behavioural problems that can't be treated on the high street. My job's really varied, involves mostly working in a clinic like this one in a surgery setting, but we also work in hospital sites across the city. And so those children that can't have their teeth extracted in the surgery, we would send them to one of our hospital sites and take their teeth out under general anaesthesia. It's a great job. I absolutely love it. And it's loads of job satisfaction. And I get to work with a fantastic team.
Brilliant. Can I just quickly follow up on something, just so students have got clarity? What do you mean by community dentistry?
So the community dentistry differs from high street dentistry. So your students will probably all go to a dentist, their own family dentist. If for some reason they couldn't be treated there, so say they had an anxiety or they had a medical history, which meant it was too complex to be treated on the high street, their dentist would refer them here. So it's a secondary tier, so not quite at the hospital level, but one under that. So we offer sedation and we offer general anaesthesia.
Thank you. So Lindsay, could you give an intro to your role, please?
Yes, so I'm a dental therapist. I see patients, as Katherine's just explained, but I work under a prescription from a dentist. So I do routine dental treatment from a dentist. They'll advise, do a checkup on a patient, and I'll get the prescription. So the treatment that I offer are things like fillings, scale and polishes. I do extractions of children's baby teeth. And then dental health advice, dietary advice. So that's the treatment that I offer.
Wonderful, thank you. And last but not least, Hayley, would you mind giving an overview of your role too, please?
Yeah, so I'm Hayley. I'm the senior dental nurse of our site at Riverside and Old Swan. So I manage 7 staff, which include 5 dental nurses and 2 dental receptionists. I also help to coordinate our referral centre, so the referrals that come in from a general practice. As Katherine has said, the referrals that come in, we triage them now, so I help to coordinate that team, and I also assist with the therapists and the dentists in the clinical setting and at the hospital doing general anaesthetic.
Brilliant, thank you.
Oh, thank you all, that was really interesting. So question for you, Katherine. What is it you love most about your job, but also what is your biggest challenge?
I would say the best thing has got to be getting a hug from a formerly anxious patient who's eventually accepted treatment. And I know that sounds a bit cheesy, but it really is the best bit. The job satisfaction is fantastic. From someone who was really anxious to someone who will readily accept treatment. The most challenging thing, I think, is probably the behavioural management. So by nature of working for the community, we see those patients that aren't particularly easy to treat for a variety of reasons. And often the behavioural management of those patients is more complex and more challenging than the dentistry itself. And for example, taking teeth out in small children who are awake is particularly challenging when you've got to coax them through it. And it's not a nice procedure. Nobody likes going to the dentist. So I'd say that's probably one of the most challenging parts of my job.
You must have a lot of patience and understanding then from a skills perspective.
I'd like to think so, but maybe not on a Friday afternoon.
Brilliant. Thank you, Katherine. Thank you.
Brilliant. So that leads us on quite nicely to the next question, and one for you, Lindsay. So what skills would you say are most essential to your job?
definitely working as a team. So the whole team comes together, and that's not just the dental nurse and the dentist and the therapist. It goes as wide as like the cleaner, from the receptionist, from meeting the patients, putting them at ease when they first attend the dentist. So definitely working as a team. You need to be empathetic. You need to be a good communicator. You need to be able to explain the treatment that you're giving in a way that the patient understands. You need to be able to change your working tactics, or the way you plan your day. It may be a patient's coming for an extraction and they're not up to it that day, so which is okay. So it's about just changing the way you work on a day-to-day basis. And having a caring and empathetic manner, definitely, especially with some of the patients that we see within our dental surgeries.
Brilliant. It's always important to be adaptable, isn't it? Even in any job, I suppose, and quick thinking.
Yeah, definitely.
Thank you. So, Hayley, can you tell us what you did in work yesterday, or the last time you were in work?
Okay, so yesterday was Monday, which for us dental nurse managers is probably the busiest day for organising cover. So I always put my laptop on nice and early in the morning, because there's going to be cover coming in with sickness. So I started my morning covering sites to make sure that service needs were met, making sure the right skill mix were in the right places. And then following on from that, I was chasing up swab results for the general anaesthetic, as well as having a senior dental nurse meeting. During that meeting, I got a call to say that one of our anaesthetic clinics were going to be closed this week. So then we had the challenge of quickly getting in touch with the swabbing team, so those children weren't swabbed unnecessarily, getting the patients cancelled from that clinic. So I had help from one of my colleagues to do that. And then after that, I went over to Wiston Hospital to be part of the general anaesthetic team, where I worked in theatre, assisting the dentist.
Wow.
I
think from a young person's perspective as well, it's dead interesting to hear how varied just one day can be.
Yeah,
within your own, so that's
really varied.
Yeah.
And today I'll be completely different.
Yeah. Fab, thank you.
Thanks.
Brilliant. So I suppose over the last few years, the world's been turned on its head a little bit with the pandemic, and how people work and live have drastically changed. So Katherine, how do you predict dentistry is going to continue to change over the next couple of years?
Absolutely. You mentioned COVID there. It has changed things hugely. Not so much in community in terms of the technology, but I think in terms of dentistry from a wider perspective. So, virtual assessments, artificial intelligence, increased use of technology rather than the face-to-face that we're used to. But I also think as we go into the future, there's going to be a huge lean towards prevention of oral disease. So rather than us trying to treat it, trying to prevent it happening in the first place. And that's something that we've been working on for a long time, and that's paramount in CDS, but also in wider general practice.
Just because I'm nosy, how does a virtual assessment work?
I was only reading about these the other day. But from a community point of view, we do from the very initial assessment. So we would do a Zoom call or a Microsoft Teams call, just like this one, and just to do an assessment, so a medical history, an assessment of symptoms, assessment of pain. And if you're lucky and the video technology is good, you might get to look in someone's mouth. So you could see if they had a facial swelling, or if they were in pain, if it was a severe problem. Other than that, obviously you need a face-to-face appointment, and certainly for treatment. But I'm reading about orthodontic appointments, so general dentistry appointments, that are literally happening virtually. All their assessments done virtually, payment is taken virtually before they even step into the surgery. In fact, sometimes the prescription devices are formulated before they even get there. So I think there's a long way to go. It's going to be quite exciting.
Yeah, I think I'd like a virtual assessment. The dentist makes me nervous. Rather do it at home.
Not us. We're not scared.
Very lovely.
Okay, next question is for you, Lindsay. When did you know that this was what you wanted to do as a job or a career?
Well, I've been in dentistry a long time. So I started as a dental nurse in 1995, so 26 years ago. I worked my way up to a dental nurse manager, and that entailed not so much face-to-face with patients. It was more managing staff, which isn't what I really wanted my career pathway to go down. So I studied my GCSEs at night school, obtained 5 GCSEs, well, actually 6, and then went on to do dental therapy. So 10 years it took me, but it was at that point 10 years ago that I decided I wanted to be back in the surgery, seeing patients day to day, doing what I enjoyed most. So yeah, that was it 10 years ago, but I've had a few posts within that time, but this is definitely one that I'll be staying in.
And again, it's good for young people to know that you can change your mind, you can go in different, you can take different paths even within your existing role or career without just going to other organisations.
I worked my way up the ladder, so I started as a dental nurse, and then as a band 5 dental nurse, which I had extra responsibilities, then on to a dental nurse manager, or senior dental nurse and dental nurse manager, and then I went on to go on to do dental therapy, which I don't regret one bit.
Fab. Thank you, Lindsay. Thank you.
Brilliant. So, Hayley, what advice would you give your younger self? You know, if you could go back and think about what would be the best advice for your younger self when you're starting out on your career?
For me, it would definitely be to have confidence in yourself, and know that, you know, you have got that confidence and the belief to aspire what you want to be. Like Lindsay, I started off as a dental nurse, and when I started in community, I never thought I would be able to climb that ladder. I thought I would always stay at a dental nurse level, and I always remember Lindsay saying to me, one day you'll be one of the senior dental nurses, and I was thinking, not a chance, I just haven't got the confidence to do that. But I climbed the ladder, and I was a band 4 dental nurse to begin with, then I was a band 5 dental nurse with extra responsibilities, and now I'm the band 6 dental nurse manager, senior dental nurse. So yeah, definitely have confidence in yourself.
Brilliant. Katherine, next question is for you. How did you set yourself apart from others when you were looking to get into your first career or job?
I think for dentistry, having emotional intelligence and people skills is paramount, definitely more so than the actual, practical skills of dentistry. So in that first interview, which is obviously stressful, just like going to the dentist is stressful, I suppose, showing that you've got really good communication skills, showing that you can be empathetic, striking up a good rapport with the people you're sat next to, even when you're shaking. Confident is key. And I think if you can portray that, if you can come across that you can empathise with people and that you understand you've got really good communication skills, I think that really sets you apart.
Thank you. Thanks so much.
So, Lindsay, if I wanted to work in the NHS, in dentistry or the NHS in general, what should I do to develop myself?
Well, you'd need at least every different university accepts different grades. But for example, Liverpool, if you wanted to become a dentist or a therapist, you would need to at least 6 GCSEs. Within that, English language, a science, and that can be human physiology, biology, chemistry, physics. You would need at least one of those within the 6 GCSEs, grade C or 5 and above. And then you would need 2 A-levels, and the A-levels are an A and 2 Bs, and one of them would need to be science as well. But you would need them to be able to progress into dentistry, and that's just from Liverpool. But as I say, the different universities' requirements are different. But the around the 6, definitely 6 GCSEs and your A-levels, yeah.
Brilliant. Thank you, Lindsay. And to you again, Hayley. In terms of linking careers to the curriculum, which is the whole point of our videos and sort of creating careers in our extended work experience placements. Can you give us a little bit of an insight into what skills and knowledge you gained during your time at school that you still bring into your job every day?
Yeah, okay, so school wasn't my strength, and nor was confidence. So I think you need to have good communication skills, you need to have IT skills, which you did learn at school, empathy, respect, people skills, time management, all of those things, you know, that you would need to hold down a job, and that they are what I learned at school. I've obviously, you know, I've grown in confidence throughout the years, and that does come. But yeah, I think for myself, it is, you know, the other life skills that you learn rather than, for me.
Yeah, and I think that's for young people listening, that's generally what they're going to hear from an employer. They want to know you're going to turn up on time every day, have a smile on your face, have a positive attitude, be willing to learn. And if we can fundamentally get that right in everyone, you guys teach the skills, don't you? You guys teach the tools for the job or the trade. So yeah, it's and hopefully bringing careers into the curriculum will help young people with those basic skills.
Yeah.
Brilliant. So we've come to the end of today's session. Thank you so much for joining us. We really appreciate you taking the time out to share your wisdom with the students. I know the students would have found it really interesting, so thank you for that. Students, if you've got any questions about anything at all that was discussed today, or anything in general about dentistry, send them into careershub@growthplatform.org and we will get them answered for you. And don't forget to complete the Creating Careers roadmap that allows you to evaluate your interest in all the different job roles that you watch throughout the Creating Careers series. You can download that in the description below. So thanks again, and we will see you on the next episode of Creating Careers.